Some of the data that we're going to use is to be population-based, and we think that are looking at our whole population. And surveillance. Surveillance is a public health term that means sort of looking at what is happening out in the world and using that type of data. And we're going to evaluate what we're doing to be able to improve what we're doing and determine if what we're doing is being effective.
Okay, so we're talking about a lot of prevention. Prevention is insurers, primary prevention, right? So I'm just going to do a very short overview. Most of you here are doing prevention work. What we're talking about when we say prevention, so that we're using a shared language. So when we're talking about prevention, we're also making a distinction between awareness activities and prevention activities. So awareness activities are the brochure, the outreach event. What are some awareness activities that you do? The one-time presentation where you talk about what consent is and how to access your Red Crisis Center services, right? What are some other examples of awareness-raising activities? Information booths, perfect. Anything else?
Walk a mile.
Sorry?
Walk a mile.
Walk a mile. I was looking at you and I'm like, but I hear walk a mile and you're not talking.
Or take back the night.
Walk a mile, take back the night. Great. Yeah, advertisements. Great. So awareness raising. Raising awareness about our issue, our organization, how we get involved and volunteer. Prevention is activities that change people, communities, knowledge, beliefs, behaviors around sexual violence, right? So these activities are more focused on changing knowledge, beliefs, attitudes, behaviors. So you see the distinction. Yeah, head nods? Thank you, Lolly. That was very appreciated. Decisive head nod. And when we look at comprehensive prevention programs, we know prevention isn't just primary prevention, right? There's different levels of prevention. So awareness is part of that. Awareness raising is part of that comprehensive prevention program. I think about those like cereal ads where like Fruit Loops is part of a complete nutritious breakfast. And the rest of the breakfast is like whole wheat toast and a piece of fruit, right? So awareness isn't Fruit Loops, but it's equally important. But it's a complete picture, right? So we want to be doing in our communities, maybe not in our organization, but in our communities, we want to have these comprehensive efforts that include different levels of prevention. So we talked a little bit about primary prevention, activities that take place before violence occurs. There is secondary prevention, which are those immediate responses that target kind of the short-term consequences of violence. And then there's tertiary prevention, which are our long-term, affecting the long-term consequences of violence, things like offender treatment, longer term. So we're really, my argument when I was at my organization at RCC in San Diego was that we're all doing prevention in different ways, but at different levels. So the RPE program is laser focused on primary prevention. So what the Rape Prevention Education Program is really working to do is promote a systematic process of promoting healthy environments and behaviors that reduce the likelihood that an incident will ever happen. So we're talking about getting before violence occurs and changing the social conditions, not just the individual, but changing the social conditions in which we all run around and play and work and have relationships to prevent violence before it occurs in the first place. So this is really, the piece of the complete nutritional breakfast that RPE is, the primary prevention piece. And that is done with a lot of emphasis on using a public health model. So more and more we see public violence as a public health issue, right, and are addressing it as a public health issue. This is David's part. I just try to look at him like a beam is going to go out, but so I'll let David talk about public health model and how it applies to sexual violence prevention specifically.
So does public health and sexual violence prevention make intuitive sense? I have to say initially it didn't to me. So when I first learned about public health, I thought they were the people that closed restaurants when the food was bad. And so when I thought about what public health was, but for me, I learned about this in 1984. Which I've now gotten to ask how many of you remember 1984. The clothing was embarrassing, I will admit. Not as bad as the 70s, for those of us who go back then, and some of you don't. But in 1984, there was a Surgeon General in the United States. Does anyone remember who the Surgeon General was in 1984? General. Surgeon General. C. Everett Koop. You know him by ear. And he was appointed by President Reagan. And he came in there, and he was looking at what was the cause of health problems. And one of the serious health problems was injuries. And then we thought, what caused injuries? So what causes injuries? Accidents. We actually stopped using the word accidents, because accidents imply that it just sort of, there's no form. Like an accident would be, falling off a ladder. But they're actually, we actually call them now unintentional injuries. Because an accident sort of says there's nothing you can do about it, it's just an accident, but there are safety things you can do. So car seats was a way to resolve that. So we tried what caused injuries. When we looked at what caused injuries, particularly of younger people, we saw that violence was causing injuries. And that public health was trying to find ways to prevent injuries. So the way you're going to prevent injuries is that you're going to be able to prevent the violence from taking place. And that was the beginning of public health being able to do this. So for me, I actually got really intrigued, started studying public health in my own spare time while doing work, doing sexual violence prevention. I started studying public health because that was really interesting. I would go, I got to meet people at the public health school, and I actually started giving lectures on violence as a public health issue at the public health school. And then I decided, maybe I should go to school and study it. So I actually went to, after doing some teaching classes there, I went to start, when I became a student there and learned about public health. And I didn't learn about violence then, but I learned about the wide range of public health skills that we can do, learning from tobacco, looking at HIV prevention, looking at many other topics to be able to draw what we can do. And so we come up with a public health model. So this is the public health model that the Centers for Disease Control and Prevention have. They talk about, define what the problem is, and understand what the problem is. Now we then go over and identify what the risk and protective factors. These are the pieces that aren't the causes of violence, but factors that are associated that commonly take place, that are a risk factor is a factor that commonly takes place that we see associated with sexual violence. We'll be talking about this in greater detail a little bit later. Now, protective factors are those factors that make it less likely that sexual violence will take place. And then we develop and test prevention strategies, and then we find out what works, and then we spread them. Now, the challenge for this is that we sometimes don't know, we only know a few things that have worked around sexual violence, but we're really trying to take those lessons and spread them, and then we're also trying to keep on developing new strategies and being able to learn. So in the RPE program, what we're doing is trying to take the best knowledge we have and then apply that and then let people in your communities develop the plans that make sense based on the best lessons that we've already learned. So in this, we talk about the 10 principles of effective prevention. And I'm supposed to jump back to you, I believe. This is the whole.
No.
Yes. So when we do these 10 principles, what we're going to do is talk about 10 principles. So what we want you to do is, as each time, I want you to think about which of these principles make sense for the work you're doing. What are some examples of prevention work that you're doing now in your communities? What are some examples? High school presentations. So a lot of people are doing work in high schools, and so we'll be talking about making those comprehensive beyond the making sure that they're multi-session and that they're tied to other activities. But that's an important part. Yes. Pretty much that. Curriculum and presentations. High school, middle school clubs. So not just doing a presentation, but getting youth together where they then take a leadership, go in depth, and then they take a leadership role in making the changes within their own school, right? So not just go into middle schools and high schools, but look at because if we want to prevent this from happening, the behaviors get set much earlier, so going to preschools and elementary schools. But you're going to do that differently. You're not using a high school curriculum in a preschool, I hope.
We do that same thing with presentations to parents
and so working with parents, because the way that parents raise their children has an impact on what we can do, and they're really important influences.
we have a weekly accredited class in schools.
So have a weekly class that's accredited and they get credit for towards helping support graduation at high school. I know some of you do some community mobilizing work. Work about you're doing organizing in the community, of bringing people together to talk about these issues and take action on these issues in their community.
So educating educators with resources, mental personnel, law enforcement.
So educating the educators, because they can have an impact, because it's hard for us. I used to work in anyone here from Contra Costa County? Yeah, of course. So I used to work in Contra Costa. I remember there were 34 school districts in Contra Costa County, and we had a prevention department of 3 of us. There's no way we could get everywhere, but we could find a way to do it. So what we want to do is think about these programs, think about other ideas for programs, how to do it, how we can do these concepts. So now I'm going to hand this to Jesse to talk about comprehensive, is that right? Or did I get it wrong? Oh, no, you're doing Oh no, I see. I was going to do it. I'm going to say what the 10 programs are. Comprehensive. Just so you love it is we reviewed it last night. We've done this before. So the first one is about being comprehensive. And you have to have strategies that address risk and protective factors at multiple levels of the ecological model or prevention. This is called the ecological model. What the ecological model is it says nested things. So you can make impact for people on an individual level, reach people individually. It also is that you can work on a relationship level. So that's not just individuals, but how people relate. So like working with the teachers, or coaches, or clergy, who are parents who have a relationship with people who then can have a big impact. Or you can make community level changes. Try and change the entire school, change the way the community looks at an issue. Or work on a societal level, we're actually changing the way the media covers things, changing policies that govern pieces. And what we want to do in the RPE program is do as much on the community, on the outer layers, because we think we can have bigger and reinforce more change and go beyond just doing individual.
We're going to work with that a little more later in an applied activity.
The other model is called the spectrum prevention. How many of you have seen the spectrum prevention? I know people that really like the socio-ecological model. I know many people that have tattoos of it. They are quite. I am not one of them. I have not chosen to. But I keep on saying, if you really are committed for a tattoo, you'll get the spectrum prevention. The spectrum prevention highlights different levels of work that you can do. So the bottom one is similar to the individual, strengthening individual knowledge and skills. But then if we do community education, it does things on a community level. We can educate providers, because educating providers are able to reinforce and do that within their own work. We can foster coalitions and networks, because then we can get much more going on by bringing more organizations together. We can change the organizational practices, the way that organizations operate, so they can be able to work towards prevention. And then finally, we can influence policy and legislation. The second principle is varied teaching methods. This is the one that Jesse and I are failing at today. That's why I actually stopped and started telling stories and started asking you questions, because I wanted to make sure that you didn't just hear lecture. because lectures are not a very effective way of doing it. But it is good information. We use multiple strategies to increase understanding. So we use many different strategies of doing things. And any of us who've done work know one way doesn't do it, one multiple ways, very teaching techniques. The third one is sufficient dosage. This is a public health term. Dosage is kind of a weird term. You think usually of taking medicine, and sufficient dosage is that you're taking enough. So if you have inflammation and you want to take ibuprofen to be able to do that, you take 200 milligrams of ibuprofen, it is not going to cut your inflammation. You need to have sufficient dosage to be able to do that. How's that for a science thing? Doing one session around sexual violence prevention is not going to prevent sexual violence, unless some of you are doing an awesome presentation that can do that.
Like us today.
Okay, so we know that one thing doesn't do it. It takes a sufficient dosage. There's no magic formula. I can't say 6 sessions is the perfect formula, but that we know that it takes multiple and varied and comprehensive ways of doing it. So one thing we want to look at is make sure we have sufficient dosage. It needs to be theory-driven. I will talk about this later. I love theory. A lot of people don't. Theory is awesome, cool. I'm going to hope you leave today being at the end saying, wow, theory can help me to think about what we need to do to improve what we can do. And so that's the goal of theory. You don't have to understand all the details of it. We can help support you in understanding how theory can help what you're doing. You have to build on positive relationships. And in some ways, this becomes very important, that no matter how good your content is, no matter how good your teaching techniques are, if you don't have a good relationship with people, it's not going to get anywhere. If all of you can't stand me, the odds are what I'm going to say is not going to help a whole lot. I've got 2 minutes left. Appropriately timed.
We only have 3 hours.
You have to do it at the right time. So when we're talking about preschool, it's not the time at preschool. We're talking about negotiating condoms. Right? Now, I was going to say, but it is a time to talk about consent, but the consent you talk about at preschool is a very different consent than you talk about in high school. So in preschool, you're going to talk about an appropriately timed consent. So like before you hug someone, you ask them. That's really an age-appropriate preschool activity. Whereas in high school, that still is a relevant message. It's amazing that preschool stuff works all through life, but all I learned in kindergarten or something, looking at a book like that. So, but it's being appropriately timed. It has to be socially, culturally relevant. We cannot come up with programs, and so many of our programs were developed in white middle-class communities, and then we can expect that it's going to work in all communities. Right next door, we actually have a gathering of people working with farm workers and janitorial workers, and talking about work that they're, and you'll be seeing this in the conference, there'll be many workshops doing that, and we're coming up with a culturally appropriate way to be able to talk about how to look at how they can be able to make changes within their community, and how to be able to do that. You're going to do that very differently than you're going to be, and depending on the community. So now, I didn't figure, so when you're in Riverside County, it's, in some of the more, in the rural areas, it's going to be very different than in Richmond, California. That the demographics are going to be different, that the cultural expectations are different, that we have to be able to find ways to do those in an appropriate way, and that you need to know your communities and learn from your communities to make sure that we're able to do this. Going over and showing old videos that don't make sense to people's lives, that don't relate, aren't going to help. We need to look at outcome evaluation. We need to measure. Outcomes are what we think is going to come out of what we're going to do, and we need to evaluate that. If we just do things thinking people loved it, that's not, I call them smile evaluation. You do smile. Did you like what we did? That's not as helpful. The issue is what did you get out of it? And did it meet the goal that you were trying to accomplish? And we need to evaluate what we're doing. You have to do this with well-trained staff. And that it takes that preparation. Part of the reason that we're doing it, how many of you are in your agency for less than 1 year? This was a great session to go to. This is helping you become well-trained staff. And so we want to be able to give that preparation and support of doing that. And I know I've started jobs where they've just thrown me a curriculum and said, you're scheduled to go into school next week. Go! That was not modeling well-trained staff. And that we want to be evidence-based. And what I mean by evidence-based, that we are drawing on and learning the lessons that we have seen and make best decisions on best available research, the experiential evidence, the contextual evidence that we have. I can talk about this for hours, and I am not going to because I went over for 1 minute.
1 minute. Was anybody?
Okay, 1 minute more than it. If you want to see description on this, the current RPE guidelines are really helpful. They're available on the hub. If you want to get onto the hub, give us your card or your contact information. Give them all to Megan. Megan will then send you an invitation to get onto the hub. So she can be able to do that. So we can be able to do that. That describes all of these principles. We took all these principles from those guidelines. And then another great way to do that is if you want to go through, it's like a 15-minute online course on primary prevention. I highly recommend it. It was developed by our really good friend Mo Lewis out of the National Sexual Violence Resource Center. It's primary prevention primer. It's an online unit. It's great. I recommend everyone here do it just to be able to do that. And then if you need to share these concepts with people, you can get that. And with that, I'm now going to hand it over.
All right. So we've talked in those 10 principles about cultural relevancy and being well-timed to the community. We want to go to a community that's ready to hear our message to some degree, right? So we can begin thinking about our programs and our program strategies by doing community assessment. So one of those other best practices is using data, being theory-driven. So we want to take some time to learn about the community that we want to work in. So how are some ways that you've done community assessment? What are some data points you might use? What are some strategies? I'm throwing it out there before I show anything because I think you all know a lot of this information, right? To some degree. RPE programs did community assessment at the beginning. What did you do? Surveys? Community profiles? Surveys and community profiles are important keys. Who did you survey? Everybody? Hey, if you're in a small town, you could survey everybody, right? The town I grew up in, you could survey everyone. So in community, we want to use community assessment. We want to gather that data on the community and talk to the community and be led by the community so that we can ensure that our program's effective because it's relevant to the community, because they're ready for it, because it's respectful to their values and beliefs and current norms, even though we're trying to change those norms. But we still, want to approach the community in a way that feels respectful. So it helps us ensure that some of those 10 principles of prevention are addressed and that the more we can be led by the community and the data that we learn about the community, the more effective and well accepted and integrated community our program is. So when we're talking about how do we do that community assessment, right? So we want to have a thoughtful process. We want to spend a little time thinking about who the community is. Do we have a primary audience already in mind? A lot of people are working in schools. So we might start with those students at the school, and then we might build out to look at some other data points, right? So we might want to survey them through paper surveys, SurveyMonkey, focus groups, maybe individual interviews with some of the students who have leadership, who are leaders on campus, both traditional and non-traditional leaders. But we also want to collect data about the community. How often is sexual violence happening in the community? What are some other related things you might look at? You might look at the service numbers from your rape crisis center, right? That might tell you something. If your primary audience is young people, you might look really specifically at those numbers. And we also have some other key data points, right? Like schools, I'm harping on schools because a lot of you are working in schools. But what's some other data that we might find from our schools that might be helpful to inform our work, sexual violence prevention work? What are some related issues? Because some of our schools, right, they're not collecting sexual violence data, right? Whose school is not collecting sexual violence prevention data, right? Yeah, a lot. So what are some related issues that might inform our assessment? Yes? Bullying and interpersonal violence, right? Mm-hmm. What they think they know? Yeah. Yeah. So what do they think is happening on campus? What do they think might be good ways to stop violence on campus? What are some other related information we would look at? Gang violence? Yes. Drugs and alcohol, other high-risk behavior. Yeah, sex education programs. And they might be doing some assessment in there that might inform how we collaborate and dovetail with their program for some collective impact, right? Sexual harassment. What about a lot of school campuses are looking at and asking questions of students and staff around whether they feel safe at school. Yeah, safe spots, school climate. So we want to gather a lot of different pieces of information from a lot of different areas. And you also might look at crime data through the police department and things like that to inform your work. So we want to have a thoughtful process. We want to collect data. Who do we want to collect it from? This says key stakeholders. Who the heck are key stakeholders? They're the students, right? If we're looking, they're young people. They're our primary audience. If that's young people, if it's parents, if it's legislators, if it's the school board, we want to be sure that we're collecting information from them. What else? Maybe from there we want to move on to that outer circle of teachers, parents, if we're at a school. Who are some of your collaborators? Other service providers? Medical providers? What else? I'm staring at the people in front so they feel compelled to answer. Police department, faith-based communities, school social workers, school counselors, school nurses. Anybody else? Any different providers you might think about? There's some new work being done on multi-sector approaches. So looking at housing development and food justice folks and housing justice folks who have engaged communities who are mobilizing around healthy and safe communities. They might be great partners to work with. So community assessment allows you to get in and find out who those people are that can inform your message, but also deliver your message potentially. Rehab centers. So there's a lot of, being strategic about how you do community assessment. I know when I first did community assessment, I was like, I'll make a survey and give it to this group. And then I have my assessment. And so now I really see the value in being really strategic and really thinking through lot of key stakeholders who are invested in having safe and healthy communities. So there's some already set data sources that we can use. California Healthy Kids Survey, the Youth Risk Behavior Survey, we talked about our police reports, our school data. So it's important to try to use some data sources that are already there, because that way we can kind of triangulate the data. We can show the data against one another. So if the California Healthy Kids Survey shows a certain percentage of kids not feeling safe on campus, and we're talking to kids who are saying they don't feel safe on campus, and then we're showing high rates of bullying in the, behavior reports, then we can see that follows. It's consistent data that we can use to inform our program. So it helps us with showing the consistency in the data. It helps us with taking our message to decision makers so that they let us do what we want to do. Right? And it also helps to kind of, we know that communities, especially high needs, low income, communities with high risk behaviors, they get surveyed a lot. So it kind of helps with survey fatigue too. If we can collect some data without having to collect some of this data that we can get without having to go with a million surveys about different things all the time, it's nice. I call it, and it might be common, survey fatigue, right? So I work with some communities that in other areas of public health that are like, the county's going to do another survey, you guys are going to do another survey, and what do we get? So I think it's nice to use some of this data that's already there, and I know our health departments, our CDC, they're working on developing these data sets that we need to inform our work. So I just encourage you to look for what's already out there, because it also saves us time, right? So we don't reinvent the wheel, really, talking to those key stakeholders at school and finding out what kind of assessments are they doing of the youth and how can they relate to inform what you're doing. So this piece of data collection is an important piece to making sure that your program and your messaging is aligned with your community. So it's an important piece. Any questions about that? We have some resources for you too, and I want to ask you, which of the 10 principles does this relate to? Community assessment. So we want you to think about the application of these 10 principles. This is our very 3-second, very teaching. It's not a 7, socioculturally relevant, right? What else? 8, outcome evaluation. Yeah, we might use that to develop some indicators to show what behaviors we want to change. 10, evidence-based. Theory-driven. Yeah, that could be. That might tell us. That might help inform our theory of change. Anything else? 3, sufficient dosage. Okay. So finding out, some information about what people need, the concentration level, the layers to affect change, which we'll talk about with comprehensive programs. All right, great. So here's a couple resources. This is my new favorite resource, the Community Toolbox. And it's really comprehensive. It's not sexual violence prevention focused, but it's applicable to our area of work. And then this is from the Texas Association Against Sexual Assault, and that is related to sexual violence prevention.
Can you mention the next training that you're related to this coming up?
Yeah, we're going to have a training, yes. It's like a variety show. We're going to have a training on community assessment and using data in January. So it's appropriate this time to right before the RFA comes out. So we do follow these things, right, in our long-term work. So we're going to be having that in January, and it'll be really useful for looking at how to do these different methods of community assessment, hopefully in a community-led way, so that you are gaining buy-in from the community, they become your messengers, but also how we use that data to both inform our programs, either the continued implementation of our programs or starting up new programs, and also how to share your story, how to tell the story of what's happening in the community, what the community is doing. And I wish we had more time because I'm looking at people in the room and they have great stuff that they share. Someday, maybe have community assessment training. All right, moving on.
When you think of evaluation, what do you think about? Surveys. What do you think of doing evaluation? How many of you collect surveys? How many of you do post-test forms afterwards? When you get them on pieces of paper, and then what do you do with them?
Insert them.
Put them in the file drawer.
Put them in the file drawer, and then you realize you have to
Input them.
input them, and it takes a lot of time. And so evaluate, and then sometimes people think about having outside people that are researchers or evaluators. Again, will do it to a program, make a judgment of a program. What we feel, and what's really important to the RPE program, is to have evaluation and think about evaluation from the very beginning of the process, designing what we do. And evaluation sort of has two purposes. One is to improve what we're doing. You're doing evaluation all the time. How many of you have ever done a prevention activity and it didn't work? How many has it ever happened to any of you? Only like, oh, okay. And then what you do is you go through your mind and you say to yourself, what didn't work? I'm going to try something different. And then you're going to try something out different. You actually are sort of doing an evaluation of how did you know it didn't work, and then you're trying to figure out how you do it differently. So there's a place that we look at how to improve it, and we use often process evaluation that highlights, how we did it. And, so that could be how many sessions we had, how many people liked it, how many shares and likes are we're evaluating like on a Facebook or social media campaign. So you can get metrics of that, and how many people participated or how many people did things. You might get some information, but it's about what was done and sort of how it was done. And then outcomes is the piece that we also want to make sure we get, and that's what changed. So when we do something, how do we do it? I'll give an example of a failure that I had. This was many years ago, and I was going to fight for funding for a program and do it, and I managed to I came up with a media campaign to be able to get the funding, and my outcome was to get people to increase the funding on our program. And I go over and I get on all the top news stations in the Bay Area, and I'm being interviewed, and I'm talking about it, and my next door neighbor that says, David, I saw you in the news, that was great. And I go, what do you think about what I talked about? He goes, what do you talk about? I don't know, I saw you and said, oh, I know that guy. No outcome whatsoever. I wasn't successful. Even though I did all the activities I intended to do, I didn't get the funding increase, I didn't get the funding I wanted, and so I wasn't successful, even though it looked like it might have been good because people saw it. So we need to figure out what changes. When we do our work, what do we want to have outcome? We know that at the end of our presentations in schools, if we're doing that or doing a community organizing effort, that we're not going to necessarily see a decrease in rape rates going on in that community based on work that we've been doing even in a 6-month period, or a year period, or a 2-year period. It takes a while, but there are other outcomes that we might want to have change. So if I'm doing a youth leadership program, I might want to try to talk about, my goal is to have youth demonstrate leadership skills. And that I can see in a period of time. Then I want to start seeing, do those leadership skills have an impact in the school? And that's next to that dimension. Those are outcomes that we're trying to do. Part of the way we do it is a tool called SMART objectives. How many people are familiar with SMART objectives? Okay. SMART is a stands for specific, measurable, achievable, relevant, and time-bound. We actually, we have that handout in your packet of there, so you can, and if anyone's missing, we still have a few packets left. So, and you've already been grabbed. So we have 2 packets left.
We have no packets.
Okay, so specific means, I should probably, is that you know that you're really specific about what it is and it's clear about what you're trying to be able to do. And so we want to be able to find a way that it's focused, so it can't be overly broad. Measurable, this is a hard one. We want to find a way to measure that it happens. And find a way to be able to come up with some form of measurement. We're going to go through some examples. It has to be achievable. It means that you can be something that you can actually do. So you don't want to come up with things that are too broad, but things that you can actually achieve. And you want to make sure it's relevant to what you're trying to do. That it makes sense. Because if you're going to be doing something around sexual violence prevention, and then you say that I want them to be able to make sure they use their car seats, I'm not sure that's relevant to what you're doing, even though it might be helpful. And it has to be time-bound. You have to know when you are trying to be able to do this. So there's a whole lot of places to learn about it. We're going to give you resources on it, but we're now going to do a little question. Is this a SMART objective? At the end of a 45-minute presentation, rape rates will decrease in the community. Is that a SMART objective? Why not? Okay, it's not measurable. Well, it is measurable, because I could measure my rape rates. Now, it's hard to measure them before a 45-minute presentation and after the 45-minute presentation, because measuring rape rates is actually complicated. How do you measure a rape rate? You could measure it by number of police calls, but is that a very good number? Because actually, or let's say you're working at a college campus, and you look at your number of Clery reports, doing that. If your school shows 0 rapes, does that mean that it's a really good school to prevent rape? No, actually, what does it actually say? They don't care about it, and they actually are not an environment that's safe for people to report it. 90% of American colleges report 0 rapes in their Clery reports. Now, get outraged moment. Okay. Why else is it not? So rape rates are measurable, but they're complicated. But why else is not SMART? Time bound, but not realistic. It's not achievable. 45 minutes. I mean, it's got to be a hell of a presentation. Even Jesse and I couldn't pull that. It's not really specific because what's the presentation, what's it about, what's the key elements of that, and
It's wrong with target audience.
Yeah, about the target audience. So, but you can see, so that's clear. Okay, let's go to a more complex. At the end of a 6-session curriculum, students will understand sexual violence prevention. Is that SMART objective? Closer. Yeah, what?
I feel like it's lacking specifics.
It's lacking specifics because what the heck is understand sexual violence prevention? And then does understanding sexual violence prevention, how, well, like, if you're going to a preschool class, how important is it that they understand sexual violence prevention? What you want to be able to have them names, it's not. What you want them to be able to do is be able to have real, we want them to be able to know where they can get help. We want them to know, to be able to, to ask permission before they touch someone, or that it's not their fault. There's things that we can be able to do. So, now this is nice because it does have 6-session curriculum, so you feel like dosage, that's cool, but it's still sort of vague. And it's, it's somewhat timed down because it sort of could be, at the end of 6 sessions, which you don't know how long that's going to take, but it's still sort of vague. But it's better than 45 minutes you're going to reduce rape rates in your community as a SMART thing. By the completion of a 10-session training program, youth leaders will describe 3 methods they will use to assess community readiness. That's SMART. Why is it SMART? Okay, so it's specific. So it's specific about what the intervention is. It's a 10-session program. It's specific about what we're trying to do. We're asking them to describe 3 methods. Describe's a really good verb. In objectives, I never use the objective understand. Understand is really hard to measure. But describe I can do. And how would you measure describing 3 methods? So you could do a presentation, and what you could do is, on the presentation, say, okay, can you describe a method, describe another method. Check it off, there it's done. You could do it as a survey or a test. I wouldn't want to do it as a test, but it's a way, and you might even integrate that into a training activity that you did with your youth leadership program, where you're going to say, all of us are going to practice how we're going to do this, and how we're going to get information, because our job next week is to get information to determine if our community is ready to take action. So what are you going to do?
I had an instructor in instructional design who had a great, quick test for whether objectives were measurable. And it was the, hey mom, watch me, ... test, or dad, or whoever you want to watch you. But you can't be hey mom, watch me understand what sexual violence is. But you can say, hey dad, watch me describe sexual violence prevention. So it was kind of this, it really makes you think about, can you, whether you can measure it, whether somebody can actually observe it or not.
When I train people in more detail, I look at the verbs. Describe, identify, demonstrate. Those are things that I can be able to do that started to be helpful to be able to do things. So when, why, and when. It gives you the evaluation about, important information about the success, the meeting its objectives, and when you do it at the beginning. You do it in the planning stages. You think about the evaluation. And that's something that we often, when I started doing this work, I sort of evaluation was at the end of doing it. How do we show it was working? But if we want to think about how we're going to understand this, and so a lot of what we're going to be talking about later on in our logic model and our theory is theory-driven, helps us understand, developing our work plan, or ways that we then think about what we're trying to measure at the end. So a lot of it is understanding what you're trying to accomplish. When I did training of youth leaders, I spent a lot of time actually training them on developing learning objectives. And then their job was, when they were working with other students in school, they had to decide what they wanted to accomplish. And it was actually developing SMART objectives. And I actually trained them on how to do that. Because I said, what do you want people to get at the end of what you're doing? And then how are you going to determine that you did it? And that's what they started thinking about before they decided how they were going to do it. They first decided what they wanted to do. Because then it became much clearer and more focused. To me, this really helps as an educator, as a prevention person, because then I'm reminded of what I'm trying to accomplish. That's what I'm trying to move forward, is to meet what I'm trying to accomplish. Now, this is a outcome evaluation. I believe this is, did we put this in your piece? It's sort of an outcome evaluation process that you can go through. So it's the assignment that we're not going to run through now, but you can, what's your goal you're trying to accomplish? Who will it change? What will it change? By how much? By when? How will it be measured? And then you can come up with your outcome statement. It's just a way to help you in developing some of your evaluation moving forward. For the RPE program, what we're looking at doing is finding ways to really provide support. The California Department of Public Health has just got new money from the Centers for Disease Control to supplement the RPE program, to be able to look at building our evaluation capacity and try to determine how much of this can be done by, that CDPH can help support people in what they're doing and figuring out how you can do things. But as you do your programming, whether or not it's RPE, you always want to figure out how to evaluate it, how to know that you're accomplishing what you're trying to do. I should skip the scope of work for this training here. And then how do you measure them? Then that's the techniques. And we do have a handout that in your piece that does show some of the techniques that people use. Here's common ones. Pre and post tests, those are surveys. A pre and post test is when you do it beforehand and afterwards, and then you measure the change. Another way of doing it is focus groups. How many of you have done focus groups? Focus groups are you take people you've been working. I did this at once. I worked at a school, and we went 6 months after we did our work. We went over and we did a focus group, and we managed to get somehow money for pizza, so that we got there. We did a focus group, and we asked people, did you remember what we did? And then we asked, what impact did it have, and how did it affect what was going on in how you interact with your peers? And so that was a way that we were actually measuring the impact of what we did beyond. At the end of the presentation, I learned, and I think I will do something. It was very different. Did you actually remember it? Did you actually use it? And what we found was that people actually reported how they used the information and used the skills that they learned in the program later on. And that was much more helpful than a post thing I did at the end of my presentation. Because the end of the presentation only tells me what people say they think they might do, but then we don't know what they're going to do. So it was a really helpful way. The risk in that was, and the person who did it, I said, I believe it might mean that no one remembered what we did and it had no impact. That is good information to have. If no one remembers what you did and it didn't have any impact, and no one used any of it, then maybe we shouldn't be doing that. And so that's good information, even though it feels like, and so we came into it expecting no response and no success, and we were pleased with what we got, but we wanted to not, because if you always want to show that everything works, you're not going to learn it. You learn more from your mistakes often than as much as you learn from your success. The other one is observations, and being able to do work and how you make observations. And the key is to do this in a systematic, thoughtful way. So one of the things that I think is really good after you do any prevention activity is to write down, it has some type of form where you write down your observations and what you saw and how you did it. This was well received. There was a lot of engagement. There was, people got quiet. No one paid attention when we did this. Get those patterns of information that you can be able to gather, observations, particularly if you're going to do things like we're trying to measure some sense of change. What other ways can you measure outcomes? So, right, so community projects, but then you have to figure out how you're going to evaluate those community projects. So some of them are going to be process outcomes, how many people showed up, how many people were involved. How do you measure the impact of it? And sometimes it's hard. That's why you want to be clear about what you're trying to do. So, I remember doing one with community fair, and it was, hands are not for hurting art exercise. So I can measure how many people did it and how many people liked it. But then, then we tried to get some outcomes of, we were measuring what was called behavioral intent. What do you intend to do afterwards? And that was a way to be able to measure some of the effectiveness at that session. And then we could look at it later on. So, which of these 10 principles have to do with evaluation and measurement? Okay, I heard 2. Very could have something, but it might not necessarily have that to do. What else? 4, theory-driven. So if you have by thinking through and coming up with really good objectives, you have to, and you answer the question why something can happen, that can be theory-driven. What else? There's one really obvious one. 8. At the end, we're going to ask you to pick one of these that you're going to work on. Think about what you're going to do to try to improve on one of these. Resources. We've got some really great resources that are out there. The one that I'm doing, and I'm not going to go through all of them, there's an opportunity. Many of these are e-learning units that we have put together on Prevent Connect, where you can actually just go through a little bit of a class thinking about how to be able to do that. This one that we have a picture on the bottom, integrated evaluations for program improvement, I believe is what it is. It's based on a handbook called activity-based evaluation. It's about how you can evaluate while you're doing your prevention work. And so it's about, instead of relying only on post surveys, but also thinking about how you collect information. Jesse talked about we want to gather information from multiple sources to get information what we call triangulate. You get multiple ways of information to be able to determine learn what's going on. Okay. Risk, take a breath. I'm going to do one more section, and then we're going to take a break. But I said that, so I'm going to do it. So this is like not always the easiest one. Risk and protective factors. I talked about them briefly. It's a really important concept that I want, and it's not the most intuitive one. It's one that takes at some levels it is. Risk factors. So these are what we're talking about. Risk factors are those factors that increase the likelihood of sexual violence. Things that are going to increase the chances that it could happen. And protective factors decrease the likelihood. And that they're not the causes. It's really important. So we might see things that are associated, but we don't know that they cause them, but we know that they're associated. And we want to be able to make that change to be able to do that. To be able to do that, you use your community assessment and some of your research to figure out what those are. It's really helpful to understand what risk factor you're trying to change. It's easier to often address the risk factor than being able to try to decrease the sexual violence rates themselves. So the CDC's done a lot of research, there's a lot of good reports, and so we're going to go over and look at understand how we can be able to do that. So here's a list. This is really easy to read, right? Okay, so you're going to want to do it. But here's some of the, now they divide the risk factors by the social ecological model. What was that? Remember that one? The tattoo one I was recommending? Not recommending, but individual, community, relationship, community, and society. There's a lot more research that's been done on individual than there's been on community. In the RPE program, though, we want to spend more time focusing on the community ones. Individual risk factors are like alcohol and drug use. Now, remember I said this is not a cause of sexual violence, perpetration, or victimization, but it's associated with it. Delinquency, empathetic deficit. These are ones actually around perpetration mainly. Empathetic deficiencies, general aggressiveness and acceptance of violence. Early sexual initiation, coercive sexual fantasies, preference for impersonal sex and sexual risk-making, exposure to sexually explicit media, hostility towards women, adherence to traditional gender roles, hypermasculinity, suicidal behavior, and prior sexual victimization or perpetration. Those are risk factors for sexual violence perpetration. So when you think about those, what are, like, adherence to traditional gender roles, what's some types of things that you might try to do to address that risk factor? Lessen that risk factor. What would you try to do? Adherence to traditional gender roles. How many of you in your education do stuff around gender socialization? How many of you do exercise? What type of exercises do you do? Gender box. Feel familiar with this? Act like a man, act like a lady is often how one of the society's messages, and then trying to get, finding ways to encourage people to not. We have a lot of programs here that are doing work just with work with youth, just young men or young women, and being able to find ways to be able to then change the gender roles and then to be able to change so people aren't adhering to traditional gender roles and being able to then not adhere to that, and then for men move away from the hypermasculinity. And so those become some of the types of techniques they do. That's the way that you look at a risk factor and focus on that risk factor. There are some relationship factors, family environment characterized by physical violence, childhood history of physical, sexual, or emotional abuse, emotionally unsupported family environment, poor parent-child relationships, association with sexually aggressive, hypermasculine, delinquent peers, involvement in violent or abusive relationship. Yeah, those would be different types of types of things you're going to work on. And then the community ones become issues of poverty, lack of employment opportunity, lack of institutional support from police and judicial systems, tolerance of sexual violence in the community, weak community sanctions against sexual violence perpetrators. So those would be different types of activities that you could be doing. So I recommend you look at these and spend time understanding that we don't know as much about protective factors, but we do know some. And some of them are parental use of reasoning to solve family climate, emotional health and connectedness, academic achievement, empathy and concern for how one's actions affect another. And so there are some things they know that do protect people. And so we want to be able to think of ways to enhance those. So we've got a couple, I want to take a couple moments and have you take out the sheet. It's called Matching Social Norms, Modified List of Next Steps.
And if you don't have a packet, you can look on your neighbors.
So what I want you to do is turn to someone next to you, your neighbor, and it might be the neighbor who has the packet, who's not you, or you can do it as a table as a whole. I'll let you do that. And I want you to talk about three social norms. The social norm are sort of these expectations that we see in our society. So there's some social norms around gender socialization. So what's a social norm about male gender socialization? The men are supposed to be not have or show any emotions. So we might want to do something on gender socialization for men to be able to have them learn to express feelings. Or have feelings. Well, they have feelings. It's about expressing them. They don't know that they have. Another one is the normalization of violence and power. That when we see that violence is just considered a normal part of life, there's nothing you can do about it. How do you counter that? And the other one is that there's limited concepts of health and sexuality that people often don't think about. And because this is sort of how we can promote healthy sexuality, that would actually help people have an impact in being able to prevent sexual violence. So I want you just to think about what are the risk factors. So go look at one or two of these and look at the list of risk factors that you have on the other list, or things that you see as risk factors. Just think about what are some of the risk factors that are associated with that. So I'm just going to do this for a few moments, and I want you just to go look at the list and have a pick one to start with and see what you can talk about it.
Yeah. I call this the risk and effective factors that relate to that particular social norm. Remember, effective activities are based on modifying risk and effective factors. So, like, I'd say, like, risk factors and attitudes and social attitudes. You know, like, allowing boys. This way you identify risk and having girls and boys in the space, not gender. Yeah. It's good, yeah. It's I live That's really bad. In Portland, like, if someone had to do a show, like a band.
I do have it like that too. Like a barrier, she wanted to face it out.
They're really based on violence. Rick, having a question. Sorry.
Hey!
How do you say like celebrities?
Resident
Okay,
leadership.
thank you all. Thank you all. So, quickly, so this is a practice that's a different practice than we often think about in what we're doing. But I really think that the more consideration we look at risk factors, it helps give us that focus when we want to develop our SMART objectives about what we're trying to be able to change. The risk factors to it, it also gives great evidence, and as you're writing up your programs, and perhaps as you're writing proposals, if you understand your risk factors that you're trying to be able to change, it's going to strengthen how you're able to think about developing your program. So, I'm aware of the time, so I think I am going to actually
Let's get a couple of
who wants to give a couple examples? Tell us the norm and tell us the risk factors that you're thinking about. Great.
So being Native American, we had a lot of rape among our women during commission during our colonization period. So we do have that along that's been historical passed down through generations. So we have that generational trauma.
So recognize, so looking at Native American, how the generational trauma from colonialization and
Of the raping of the women.
the history of the raping of women that we have seen for hundreds of years in this country. And so being able to find ways to recognize and be able to do that, that's a way to unfold that, looking at the historical trauma. It's not saying at the end of a 45-minute presentation we are going to end historical trauma, because it's actually, there's genetic, it even affects people, there, but there's a way that we can be able to identify steps that would be important. That's great, thank you. And a wonderful way of looking at some of the societal and community level ways in how people touch what people do. Thank you, that's a great example. Yes, Jesse's going to run with mic.
I didn't get any exercise this morning, so that's good.
So our social norm, gender socialization, and some of the risk factors were under societal risk factors. So societal norms that support sexual violence, societal norms that support male superiority and sexual entitlement, societal norms that maintain women's inferiority and sexual submissiveness, and then weak laws and policies related to sexual violence and gender equity.
Thank you. Those are really great examples. Hard in our local community to often do it, because then think about how do we then start operationalizing that. Think about what changes we're trying to create within ours. That's going to, ending male entitlement is a crucial part of what we can do to be able to shift around from rape culture. And then it's thinking about how to operationalize. The risk factor helps give us a little bit of language to start. Great. One more.
Thank you. One of the things we were talking about was the social norm being gender socialization, and modifiable risk was, I guess we said, that idea that only men are perpetrators. So how to address the fact that there is stigma behind men being victims of sexual assault. And some of the protective factors that we were able to come up with was finding ways to create a safe environment for men to be able to disclose, as well as kind of increase empathy among each other, kind of not be afraid to disclose. But yeah.
So creating a place where it's safe for men to disclose, because one of the things that we've seen is one of the barriers for people, for men coming forward, is indeed the expectations of what's male socialization, that men can't be seen as weak. And so, and being seen as a victim is being seen as weak. There's a lot of assumptions there of how we can do it. There's even ways in how we frame this. It used to be that the CDC put out a report on sexual violence called the National Intimate Partner and Sexual Violence Survey, NISVIS, and in there they came up with male rape rates, and they would say that 1 out of 71 men are raped. But if you look at the actual types of sexual violence, it's not rape is only one form of sexual violence. We all know that from our work. So when we then recategorized and said men who experienced physical forms of sexual violence, 1 out of 6 men. And you see how it sounds very different? 1 out of 6 men experience physical forms of sexual violence. It sounds very different than 1 out of 71 men for sexual abuse. What it does is it helps make it more normal that it acknowledges that more men do it and makes it easier. That's just a way, having nothing to do with the system of how we think about the issue. Make it there. There's a group that works with male survivors that's called 1 in 6. They were awfully happy when they came out with that stat. So, what does risk and protective factors? Which ones of these strategies does it affect? These 10 effective prevention strategies. 7 that it can be done for, and we had a great example of being culturally, of how using risk factors is socially, culturally relevant. What else? For 4, theory-driven. So once again, your theory of why do you think something is happening. What else? 8, outcome evaluation. It can help you in your outcome evaluation because then you're getting an idea of what you are trying to change. 2, varied teaching techniques. So once again, this is one that could be something that can be done, that as we look at the risk factor, we have to think about how we do that. So that could be a way that we can use that to help fuel that. 1, comprehensive. Comprehensive becomes all the different things that we do to address the issue. The risk factor we have to think about, it can't be done just in one area, it has to be done in multiple areas. When we talk about risk factors, we don't talk about modifiable risk factors. That you want to be able to do things that you think you can change. Some things you can and some things are harder to change. So you want to think about what you're able to, within your program, being able to change. But then we also want to be able to think hard. Remember, poverty is a risk factor. Hard to be able to think of you trying to be able to end poverty, but if we can do things that are going to help support that, they can move forward, we can make a difference in being able to move forward. Okay, we have resources. There's some great resources. These are some studies. The one I'm going to highlight for you is connecting the dots. It's one of my favorite tools. It looks at risk and protective factors over 5 forms of violence and looks at what are the common risk factors, because what's going to prevent sexual violence might also prevent domestic violence, might also be preventing youth violence. And so we want to be able to think about how we can be able to do that. And so it's a really great document, great charts, and it's actually one of the easier to read ones. A lot of these are a little hard to read because they're very sciencey. That one is one of the better, easier to read ones, and you actually have a picture of it there. So I recommend connecting the dots if you were to pick one, if you want to spend more time on this.
There's also a strategic vision for connecting the dots, so you might also look at that, which is not up yet.
There's going to be a new product coming up. We're working with the team at CDC to try to figure out how Prevent Connect will be supporting that. But that's why you're all signing up for Prevent Connect, so you can get these updates as they come out. Talking about theory, I have a theory that if people are great,
that they can think better.
That's my theory. What do you think?
It's a good theory. I'm pretty sure it's research based. So we want you to take a stretch, take a bio break, get some oxygen, and please join us back here at 10:45. So you have a 12-minute and 43-second break.
David.
Thank you.
Welcome back, everyone. So I want to do the evidence-based test of my theory. Was having a break helpful?
Yes.
How do I know that? What are the indicators of that? You're ready for the next. People can pay better attention. Yes, when I ask the question, everyone yes, okay, so, will the long-term impact be that for the next, hour and 10 minutes, you're gonna be focused and with it and be able to learn and apply it themselves? Okay, but, you only can go so far, with that. So, great, welcome back. I just want to highlight again, if you want electronic copies of this, all this will be, and we have materials from all of our trainings that we have done for the last several years, all on the hub. If you want to get the hub, access the hub, it is restricted to people, but you can all get that. You need to go to Megan, to either give her your card or she's going to ask you for your email address, and then we will get the invitation so you can get all that information. I recommend getting electronic copies because we give you a lot of resources, and it's really easy to just click on the link as opposed to trying to type the link that's really long and getting it wrong, and then it says no such page exists, so it's trying to free. People have that happen with them? Okay, so as I say, we have sort of failed in the theory of teaching techniques, so we've tried, you can see we've dabbled in it, but I think it's important. So, theory-driven. So we've got all these different terms that people use. There's an evidence-based, some people will talk about it, so they're like evidence-informed, and some people will be talking about practice-based. What we feel is important is we want to draw on what we know. And there's ways we know them. One is we know it from trying it out and having other people try things out and learning lessons that they've done. We also have learned a lot about this from understanding approaches of why we think something is going to work. So if I'm going over and doing a presentation, a series of presentations along with the youth leadership program, along with a school-wide campaign in my school, why do I think that's going to lead to changes? And then we go to our theories to be able to help teach us what those are. So in this, we want to talk about, as I say, there are different best practices that we want to be. We, for our RPE program, have talked about evidence-informed, that we're using evidence from studies. So Jeannie has a program. She's actually doing domestic violence, where she's going through some curriculum that are evidence-based curriculum, and then augmenting that based on theories about how that's going to strengthen the implementation. For RPE, we want to draw on them, but we don't want to limit it to things that already have only been done for published studies, but we want to use those published studies and theories to help us move forward. And so we look at this theory of change of why we think something is going to work. And it provides an evidence-based theory about how something's going to make changes in the risk and protective factors to prevent sexual violence. Now, this is a model that came from the CDC, and I really like this one. They talked about 3 different types of evidence. One of them is the best available research evidence. So we look at sexual violence prevention, and we spend time reviewing all the research studies that have been going on and seeing what we have learned. The challenge is there's only a very few evidence-based prevention programs that have been published. But right now, the CDC is evaluating 5 new RPE-funded programs around the country, and they're doing the research right now, and it will still take years before that gets published. But one of the things that we're doing is we're talking to the researchers and talking to them so we can learn the lessons as we go along, and we're going to keep sharing that. But that's not the only evidence, because there's also the experiential evidence. And so you have the experience of what it means to do prevention in your community. You know what types of things that people don't like and people do like, and things that resonate, and you know also some of the. And so understanding your experience is important, and we want to be able to draw into that. And you want to think about how you collect that. The third part of evidence is the contextual evidence. Understand what's going on. And someone gave a great example earlier by working with Native American communities, that you have to understand the context of historical trauma if you're doing prevention work. Because if all you're doing is training people about what sexual violence is without acknowledging and recognizing historical trauma, you're not going to be able to address the issues of how people experience their lives in their community. And so you have to understand that context. You also need to understand the context of what's happened in the past, and how people might have, people offered programs in the past, and then they left after the funding disappeared, so no one trusts them anymore. Happened to some of you? That's real, and we want to be able to incorporate and be able to include that. So we want to be able to think about that, and we use all those forms of evidence to make the best decision making we can. It's evidence, they call it evidence-based decision making. And that's what you want to do, is draw on those different types of evidence. So a theory of change answers the question of why do you think something's going to take place. And the way you do it is often going backwards and saying, why do you think that's going to work? And explain why you do that. And theories then give us ideas. Now there's a whole set of behavioral theories that I'm not going to go into now, because we don't have time. But that's one of the things that Jesse and I and Megan can help you with, is that if you want to be able to talk about a program, you can contact us, and we can sort of talk about some examples of theories that can be able to support the type of work you're doing. So if you're saying, we're trying to do youth leadership programs, we can say, here's some theories that can be able to help in how we move forward. So there's one theory called popular opinion leader theory, where you go over and you find people that are opinion leaders in different segments of the community. Those of you in Grass Valley, you're very familiar with this. Thinking about this, who are the leaders within the different segments? They have theory of, if you get the key people and these different people making what they call endorsements of value around things that you want people to do, that's going to lead to changes throughout the community. And it takes magic number, 15% of those people making those endorsements before that's, actually it's weird, making 14 endorsements that will then lead to the adaptation. And it's been tested out in actually HIV prevention and tobacco prevention, and we're now starting to apply it to sexual violence prevention. So it's why that takes place. So, how is theory relevant to this? And there's one really easy answer on this one. Number 4, theory-driven, yes. How else does theory help you? 10, being evidence-based. So, anything else? 7, theory is important in making sure that we're socio-culturally relevant. I will acknowledge many theories are not socially culturally relevant themselves, and they actually ignore that. So you have to be aware of that, but some of them are really important to be able to do that. There was one of those ones. 8, outcome evaluation. So that's also going to be able to do it. So we did not cover what the theories were and all of that. What I want you to do is to think about the question, why is something you think is going to work? And then you want to make sure that it's not just your idea that you came up with. You want to say, has there anyone else that had this type of experience doing it? And if theory is a way of doing that. And that's the support that it's an inquiry that's helpful for you to do, and it's a way that we can also help you in doing that. We invite you to be able to contact us. And once again, the best way to contact us is always contact Megan. She's the easiest one to find. And she doesn't have to find Jesse and me. Because we're harder to find. I will admit. I'm really hard to find. But we are there. So we have resources, understanding evidence, which is going over. We had a web conference on putting the theory and the theory of change, and we even had one called. So if some of you want to take on theory as your new challenge to strengthen your work, start with these as ways to be able to do that. So at the end, we're going to have you pick one of these 10 that you're going to work on and think about your little game plan of what you can do. That was one of our objectives. Logic model. How many of you are familiar with the logic model? How many of you love logic models? How many of you have no idea what a logic model is whatsoever? How many of you refuse to raise your hand? Okay, I've noticed in quite a few of you. That line works all the time. How many of you refuse to do that? I love logic models, and they're kind of confusing, and they're not always uniform, but they're really helpful for me. So, a logic model is a visual representation of what your program looks like. It uses these words like inputs, what you put into it, outputs, what you get out of it, and what you want to achieve. And there's lots of different ways they can look. I'm giving you some examples of what logic models look like here. You can see, it could be a chart here. They could be boxes. Logic models are famous for boxes and arrows, but sometimes they're just charts that have pieces here. This is the logic model that is currently being used with the RPE program. Now, in it, there's the inputs, and the resources. What we need to have to be able to do this. What are those different types of inputs or things we can put into it? What resources do we have available to do what we want to do? So if we're doing work and we want to be able to end poverty, we have to be aware of what resources we have. Now, if you happen to have $10 billion, you can do a different thing than if you're going to be doing a program for a local community. So you want to know what type of resources you have, how much staffing you have, not just this. That affects what goes on. It might be understanding what the resources are that you can find from your community. What are the types of things you need to put into what you're doing? Activities are, what are you going to do? Then there's the outputs. Outputs are, what are you people, the activities will result for those participants having received something. So outputs are, we're going to do 50 presentations, we're going to do 10 presentations to 5 groups, which means a total of 50 presentations. And it's going to be listening, and so we're going to do that. And so the outputs are sort of are those process outcomes, the process pieces that we talked about. And then the outcomes are what changes will happen. And sometimes you'll break that down to short term, medium term, long term. Sometimes they do it in 2 columns. There's a lot of different ways that you can do that. But what exchange, then what impact do you think that's going to have happen? How do you think that's going to lead towards what you're trying to do? Which is fundamentally prevent sexual violence. Now, let me give an example of how I used this recently. I'm on a project, it's a national project, and we're working, we got money from the Department of Justice, and we're developing a prevention program for college campuses, where we're trying to actually change the environment. And I'm working on one college campus, and we've done all these we've done all this community assessment work. We've done interviews with students, with faculty, with staff who work with sexual violence. We actually looked at a climate survey they've done, we looked at all the data, we looked at the education they've already done, we looked at all the results from all the education they've already done, and what's happened. We're now trying to be able to figure out what the problems are and how to move forward. We used the logic model, and we had to spend a lot of time on the assumptions box, which is in the back, and the external factors, because we had to see what was going on. And so we made certain assumptions about what we would think would happen. For this one particular campus, we noticed one of the things that we learned is that the rates of sexual violence for LGBTQ plus students was much higher than students who were not LGBTQ. Is that a surprise? In fact, that's probably true on almost every community setting that we have. That's what we see from the state. So we made something. So we then wanted to look at it, and we started looking at the literature, and we looked in the literature and saw some studies that have shown that in schools where there are higher acceptance, this just came out in the study, schools where there's less negative attitudes towards LGBTQ students, there is less sexual violence towards LGBTQ plus students. And so our assumption is that if we create a safer environment for LGBTQ students where they feel safer, it will actually lead to lower sexual violence. And so we went through it, and we had to look at the external factors. So some of them were where most LGBTQ students lived. They happen to live basically in one dorm. So we were able to learn about that. So these are some of the factors, and then we went through and used the logic model of how we thought something would create change. And then we used that, and my last meeting I had was with the people, the administrators of the school, to decide how they were going to do the program. We shared with them the logic model of what we thought would happen to be able to have them agree to what the program was and be able to agree on where we're going to start putting action in. And so and we took about, and these were we had a whole team of people, we took about 4 months to develop this logic model, really working on this, to be able to do it. We just had the meeting last week, and they were really excited about it, and then they actually want to test it out with other groups. So they were going to start testing it out with more groups of people to be able to see if that makes sense to them. So it's a way to help us be before we design what the program's going to look like, we want to design the logic. Does that make sense? It's a time-consuming process. It has an incredible payoff. Now, part of what we're going to do in the logic models, for RPE, that CDPH is looking at options of, and Nancy Magnato, who came yesterday, and spoke about perhaps what we're going to do with the RPE program is come up with logic models already, and you would then take those logic models and think about how you're going to be able to implement the program. That's a possibility of what this is going to look like for the next RFA. So, any questions about logic models? Can anyone tell a story about how they found a logic model helpful? Just so it's not just me. Or is it just?
Well, when the RPE
And how was it helpful doing that? And so by doing the, they had to do it for the application, so it was required. As we know, being required is not always the way that we love doing things. But what it did is it gave the opportunity for them to think about when they were doing multiple session programs, how the sessions work together to be able to work toward that goal. Because if you just did one session on dynamics of sexual violence, one session on how to get help, one session on bystander, one session on gender-based gender socialization, and that might not be a cohesive thing you wanted to move towards why you thought something. Is that explaining it well?
Yes, it was, and it also kind of gave us an overview about what are inputs and outputs found learning in high school, what they bring to the table.
Okay, so for the inputs and outputs, think about what the school would bring and what the agency would bring. Great, that's a good one.
I think that my experience with working with agencies, sometimes I know a lot of people working at the local level that you're working in the prevention field, but you're working in, say, a rape crisis center, and so you might be the only person who's really doing prevention. And a lot of times you don't feel like you're supported. Your organization might think that you're just doing a couple presentations and having a lot of fun, and this is so great. And the logic model is it's a great way to visually show your staff what you're doing, that there's a thought process involved, and you have goals to really show that it's not about just giving presentations. And I think another great reason to have the logic model is when you hire new staff, so that when you're orientating them, they truly understand why they're doing the work that they're doing. So they conceptually can see and understand the whole picture, the whole comprehensive picture of what your ultimate goal is and how you're going to get there.
One thing, and I don't know if this speaks, if you have not seen your logic model yet, ask, where's the logic model? It might not be relevant to what you're doing, because it's very weird, but it's really helpful to be able to understand that. That's part of a good orientation for any new person to be able to see. We often share the curriculum, but we don't share what the logic model is. And seeing that logic model, and you don't want to have it be just your grant writer that knows what your logic model is, or your program director. You want it. Now I have the grant directors laughing. Don't want to be deep. They're useful tools to move us forward. So, logic models. Which part of our 10 principles do they align with? All, I heard. Oh, that's like a cheat answer for everything. Of course, this is all relevant. 9, well-trained staff are going to be able to do that. What else? 2, if your logic model highlights it depends on if your logic model does. If your logic model highlights very teaching techniques and very multiple approaches, then that's really necessary. What else? 3, sufficient dosage. Once again, your logic model is going to highlight where the dosage is. 4, a logic model is going to be a visual representation. It's going to explain the theory. And 7, when you're doing socially relevant, and once again, appropriately timed, it's going to make sure the logic model should be able to do it, though it might not reference it explicitly. I gave my example earlier, we're not teaching condom use to preschoolers. Now, water balloons is a whole other story. That we're not going to go there.
Number 8.
Okay, and 8, outcome evaluation. Really great part of outcome evaluation because you're going to lay out what your outcomes are and how you are going to get there from your assumptions, your inputs. Your assumptions, your inputs, resources, your activities, the outputs that then lead to those outcomes, which will then lead to your ultimate impact of being able to contribute to these preventing sexual violence. We have many resources. We have e-learning units from using logic models for planning prevention programs. We have a whole materials for training on how I learned to stop worrying and love the logic model. If any of you got that reference, that's a movie. Well, it comes away from a long time ago. Logic models for prevention program and web conferences. We have a series of them that we did in 2004, 2014. So you've got several pieces that are there. Some of you even more up to the trainings. Jesse was working at an RPE program at the time.
Right. Comprehensive programs. I have 2 microphones, so that makes me double loud, or will it make me have a bunch of feedback in 30 minutes? So we talked a little bit about comprehensive programs at the beginning, right? It's which principle is it? The first one. Thank you. So this is the first one. So we want to look at how our strategies, so we've done our community assessment, we've thought about our theory, we've thought about how we're going to measure our outcomes, and now we're thinking about, so what are we going to do? What do we know we're going to do? Because we probably really know a lot about what we're going to do now, right? We've done a lot of strategizing. Okay, so we want to look at having activities and strategies that affect change at those different levels of either the social ecological model or the spectrum of prevention. So oh, look at that, it's big. So the ecological model, right, we have our individual on the inside. We don't just walk around as separate people not affected by anything, right? Despite that self-help book I just saw about not giving F words about anything anymore. I can't say it with David here. So anyway, but we are influenced, right, by our relationships, by our communities, and by the society at large that we live in. And so the ecological model is one way. This is a touchy button, this button. So the ecological model is one way to look at this, and then the other way to look at it, and I find people have their favorite, one makes more sense to them, like, in their head and how they arrange things. So one is the ecological model, and the second one is the spectrum of prevention. So, they're similar, right? It's a similar idea, looking at levels of influence on an individual. So, right, we're thinking about how do we influence the environment or the social conditions that people are existing, working, playing within. Okay? So when we're looking at these different levels, we want to think about how our strategies are going to affect change at these different levels. So not just what are we going to do with individuals, what are we going to do with community education, what are we going to do, but what is really that outcome, right, the what for. So we want to think about how strategies work within those. So I want to give you some examples, and I know we talked about this at the beginning. We talked about a few other public health issues like car seats or other injury prevention campaigns that there have been, or projects that there have been. So if we're thinking about, I'm going to use the ecological model. I'm going to go back to this ecological model. So I want to give an example that I think is easy to conceptualize, but when I was at conferences and they started to really introduce using public health model to address sexual violence prevention, they always used tobacco. And I was always like, yeah, tobacco has a ton of money. And they do, and they have a nice, easy message, don't smoke. It's not use tobacco, because now, 15 years later, I'm using tobacco. But it's a nice one that is clear, right? So there's a lot of complexities to messaging around violence prevention and social norms around violence prevention that are different, right? But but I want to give a practical example, because that's what I do. Practical example. So when you think about tobacco prevention over the years, they moved into a lot of these different, they moved into all of these different levels, right, with their comprehensive prevention strategies. So starting with the individual, the message was, don't smoke, quit smoking, right? It's bad for you. You'll die, you'll get cancer. Your teeth will rot, and your jaw will fall out. That's what all the commercials were, right? And so, you know, they offered also quit smoking classes, right? Health insurance, oh, that's later. So, you know, you could take, I get mixed up. So, you know, you could get help quitting smoking, strategies for quitting smoking, chew gum, chew a lollipop, you know, stuff like that. And then in the relationship level, what was the message that was really important and effective? Secondhand smoke. Yeah. It's bad for your kids. It's bad for your family members that are, and for people who are breathing in your smoke. You're going to make them sick too. It's not just you smoking, right? So that was a good relationship level strategy. Nobody wants to hurt their kids, right, with their smoke. And then at the community level, what do you think were some things that happened that changed the community, right, around, I remember the first thing being no smoking at bars. Smoking outside, yeah. You have to smoke outside everywhere now, right? Pretty much, yeah. So no smoking at bars. A lot of multi-unit, you know, and more recent things, a lot of multi-unit housing complexes are going to tobacco free. So, you know, if you live in multiple unit housing, you have to, you know, walk a certain amount of yards away from the whole building, right? So those are some community level changes that changed the conditions in which people were living, right? It's harder to smoke, so maybe less people smoke. And then what about a societal change? This large level, yes. Airport. Yeah, so that could be a community thing or a whole society thing, depending on the level, right? That could be individual airports, which may only be community, but now that's national. Yeah.
Advertising, like getting rid of Joe Camel and Marco as well as the increase in price.
The increase in price, that was a big one, right? The big heavy taxes. I think you pay as much for taxes now. There's a newer, another tax now. You had your hand raised too? I'm sorry? Well, lung cancer is an effect of, yeah, so we're wanting to prevent lung cancer by preventing smoking. Oh, and that's kind of like a structural kind of thing by not providing that tool you need in the car. I had to take my kid to the emergency room because he put his finger on that lighter, and it was really embarrassing to go to the emergency room as a non-smoker and be like, I felt like such a and it turned out they just needed to clean off his finger, so it was also a hysterical thing. So anyway, sorry, it was just crap. Go ahead. Health insurance? Discounts for non-smokers. And health systems offering specific targeted prevention programs free through your health insurance. You know, so that's kind of still an individual strategy to get individuals to quit smoking, but they made a systems change that made it more accessible. Yeah, Jim.
last 15 years, it's almost become just a stigma. You know, if you smoke, people walk away. It's just a different type of, people just don't accept
Right.
you as much.
Right. So, and thank you, because that leads into thinking about, so, you know, how has all of these different strategies at all of these different levels changed social norms around smoking, right? People, this was effective. 50% less people smoke. People still smoke, right? But where do people smoke? They don't smoke in California. They don't smoke in restaurants. They don't smoke in bars. They may not be able to smoke in their house. We don't see as many people driving down the road smoking with the windows up and kids in the car. You know, the cigarette butts is a different kind of environmental prevention change we need to make. But so this was effective, and you can see how they laid out a comprehensive prevention strategy on different levels of the ecological model, different spheres of influence that individuals work within. So we want to do that too. So, you know, I'll say again, that coming up with that clear, straight message around sexual violence prevention is harder than don't smoke, it's bad for you. Like, yeah, that's a good message, don't rape, it's bad for people. But it's not exactly, you know, may not exactly be the most. So I'll say that we're still trying to figure out those things. Hopefully one of you in the room will figure out the magic message and we can all use it and you can be famous. I'm sure you would be famous from that, right? You would be amongst all of us for generations to come at podcast conferences. So, and this is just a different way. We won't break it down across these, but you could. You know, you could break this down with, you know, car seats or, you know, other injury prevention things, or HIV prevention has done a lot of work across different levels of the ecological model. So you could break it down this way too, and just use the one that, you know, is cohesive with how your brain works. Yes, David?
To me, that's really,
It's not,
piece to me that's really important is that if we had just stuck to the individual messages of don't smoke and offering smoking cessation classes, we would have never gotten to the impact that we had. And then the first environment community, I remember going on an airplane where the no smoking section was one row. And believe me, it made no difference the amount of secondhand smoke you got. But there was one row of no smoking. But it was, and the first restaurants where there were no smoking sections was one little section with one or two tables. It made no difference from the smoking, but it set the path there for making change. And then there were incremental pieces that we then did. And then when they finally got to the Truth campaign in California, when they started saying that the tobacco industry is a problem, and they were making society level changes. And so for us in sexual violence, we have to make sure that we don't get stuck on the individual messages, because we will never make the impact that we want to do by doing it. And that's what to me is completely analogous. We don't, it's harder to blame the tobacco industry for sexual violence. You know, I'll blame them for everything anyway. But, and it's harder to find it's more complex around sexual violence. So some people have, you know, identified the pornified society. Some people have, you know, there's different some people talk about the patriarchy. Some people talk, but we want to be, but it's more complex. But we have to get to those other levels to do it. That's the lesson. So in the RPE program, we've required people to do more than the individual, and there's going to be much more emphasis on thinking about the community level work and thinking about some of the higher levels of the spectrum.
and that's what I was going to say next. That's okay, David, you're really good at saying it. So what we want to do is have you really practice thinking about what are those community level strategies, right? So we know we want to move beyond the individual because it makes our work more effective. So what do those really look like? Because I think that we're really good at connecting with our communities. We're really good at doing individual level work and relationship work and and knowing and being on the ground in our communities and being able to connect with folks. And I think it's a little harder to figure out what are the strategies that we're going to do that really make those community level changes that change social conditions, that change social norms. What's going to change the social norm that prevents perpetrators from perpetrating the first time? Ooh, that's really complex. So I want to give some practice. Because I'm a practice person. People in RPE group, they know that. So here are some examples from the youth leadership development piece, right? So individual level. Activities that build an individual's self-esteem and promote pro-social development. Relational level. Mentoring programs focused on youth's interest to increase individual capacities and self-image. So when we asked about your strategies, some of you talked about these things. So now we move into the community level, youth-led community activities, societal level, youth participation in community policy-making groups or committees. So youth affecting change at the policy level. So these are, you can see that incremental change. So what I'd like you to do, because we're pulling back from our community assessment, we're pulling back from we're pulling forward our community assessment, we're pulling forward the work we did on researching theory and evidence-based and evidence-informed programs. We're pulling on the work we did creating a logic model that's relevant in our community. So, and looking at risk and protective factors. Okay, so now I want you to spend a little time to think about what would these activities look like. So when we look at structuring a comprehensive prevention strategy, we want to look at the correlated set of risk and protective factors. So you worked on that in your activity, practicing with what were some of the correlated risk and protective factors for gender equity, for normalization of violence, right? So what I want you to do now is take that a little further. And as we're building comprehensive programs, we want to address those same risk and protective factors straight through, did the thing work? Straight through that social ecological model, right? So we don't want to have, we're addressing norms around gender equity at the community level, and we're addressing bystander intervention behavior at the individual level, and we're teaching parents about body metrics, right? To be more effective, we want to make sure that our strategies are aligned with that correlated set of risk and protective factors, and that they're going deep into the ecological model rather than wide. Does that make sense? So we want to be addressing the same set of risk and protective factors across the ecological model or across the spectrum of prevention. So I want you to practice that and think about an imaginary program, or think about your program if it happens to be one of the ones that was on the last activity, and you have a worksheet, or your neighbor does, that looks like the social ecological model. Is it on here? Yes. There it is, comprehensive program. So I want you to take one of those sets of risk and protective factors that you worked on in the last activity, and I want you to create a comprehensive prevention program in your head or with your neighbor. Sky's the limit, right? We have ultimate resources in this room right now. When we walk out, we don't anymore. But in this room right now for this activity, we have all the resources, and I want you to think about, what would the strategies be, particularly at the community level? Because we are being asked in our PE program to really change social norms and to really think about how we change the communities and the society within which folks live. So take a few minutes with that. Okay, so how'd you do? Was it hard to come up with? Did anybody have a hard time coming up with the community and societal things? Yeah, especially if we're thinking about also how we're gonna do the rest of those things, like measure community change or, find evidence-based community change programs for sexual violence prevention. There's not. Very many. So yeah, it's hard. It's harder to come up with those and to think about how we're going to measure them. And does anybody want to share a couple of the community level or one of the community level pieces that they came up with, strategies they came up with? No? That's okay. I guess I won't force people to share without their consent. Go ahead.
We did poverty,
Uh-huh.
and we thought about writing to our legislatures so they can give us money so we can help see the change in society. And then we wanted to collaborate among other agencies to kind of get feedback, and then we could better serve our individual demographic.
Yeah. So we talked into that, talking about those are great activities, and then just making sure that they're connected to the outcome that's connected to the risk and protective factors. So we were talking about social determinants of health around poverty.
One caution I just want to say, it is a great idea to be able to contact your legislators about pushing for funding. Just note that cannot be government funded activity. So you would do that not with your RPE dollars, but you would do that. That doesn't mean you can't, your organizations absolutely can do that, but you can't spend that money. But you can educate legislators about the value of prevention programming to serve the community. That is completely acceptable, but you cannot educate them to advocate for a particular piece.
And I believe there may be a webinar on that, but I also have a great video training on that if anyone is interested. So you wanted to share also what you came up with.
So I was going to work with workers.
I'm a therapist, so I work with after effect of it. So I could see so many clients lately, I'm like, how can I work in preventing? How, as a therapist, how can I work with that? And so we're just talking about maybe me going out and maybe talking to a classroom or talking to the parents, talking to our rural community about safe touch versus bad touch. And it's difficult though, because I'm trying to understand how can I implement what I know in the prevention factor. So I don't know if anybody has any examples or ways that they work as maybe as a therapist. I don't know if there's any therapists in here that have worked in prevention.
Yeah, and those are great individual and relationship level strategies, depending on your risk and protective factors. And there are some folks using some expressive arts therapeutic, practices or, adapting those for prevention work because, right, we're doing primary prevention, but our communities, the statistics on experiencing sexual violence are high, right? So, a lot of times we do have folks in our groups, in our communities, not a lot of times, we always have folks in our groups and communities that have experienced trauma. So, needing to do even prevention work in trauma-informed ways is another important piece. So some people are having really good luck using expressive arts as a way to, address trauma, but also as a way to think about how do we express things in different ways through art, through spoken word, through different things. So I'm seeing that a little bit.
I look forward to some work with a group called the Association for the Treatment of Sexual Abusers. And they are clinicians who do work with sexual abusers. And their mission is to prevent sexual violence from reoccurring. But so part of what we're asking for them to do as a therapist community is to be able to say, based on our experience with what we've seen, we need to make investments towards preventing it from happening in the first place. And that we have insights about what the trauma is and what the harm is, and that we need to be able to do to be thoughtful in how we can be able to move forward. And so it becomes really important for clinicians, whether or not they're working with people who caused harm or those who are survivors, to be able to say that we cannot therapy our way out of this problem. We need therapy, but we know we need to be able to change the conditions that this happens. It's a lot easier, and to have therapists' voice and going to therapy organizations and saying that we are going to push for the policies that group at the back table is advocating for getting more prevention programs, is really important to use the credibility that you have as therapists and the social power that you have. Because therapists have certain, especially in your statewide chapter or your county chapter, raising that we support prevention. And it's not about we're in it for ourselves to get more clients. We're actually in it for ourselves to get less clients.
Yeah. Always think about if we achieve our missions, we're putting ourselves out of work. Maybe not prevention, because so it's continuous. But I'd like to point out, just if we're looking at the spectrum of prevention, you all have talked about influencing policy and legislation. You talked about educating providers. So I just wanted to point those out just to see how that one breaks down also. So, comprehensive prevention programs. Got a little practice. What of the 10 principles of effective prevention programs? Comprehensive. It's at the end, so it's a good, nice, easy question at the very end. Great. So, here are some resources on creating comprehensive prevention efforts. Using the spectrum of prevention is a good one. I like that one. And then comprehensive prevention efforts. There's a lot of resources on this piece out there, so we hope that you'll dig into them. So, our next thing. So, we're ready. We came up with our strategies, we did our research, we have our evidence, we know how much dosage to do, our activities are comprehensive, and they shoot through, I shouldn't use the term shoot. I don't know, somebody can tell me if it's what it is. They go right through easily into the ecological model with shared risk protective factors, so we're ready to go. Okay, so when we're looking at implementation, we are picking up some of these other 10 principles, right? Being socio-culturally relevant, using various teaching methods, creating positive relationships. So hopefully in all that community assessment, data gathering, build trusting, authentic relationships with our collaborative partners, with our primary audience. So something when I'm talking to all the RPE programs, I mean, the key thing is that, that one of the keys of their success is that their community knows them, they connect with them, they trust them, they're consistent. So those are all really important, but not necessarily showing up in the measurable objectives. Maybe they should. And that they're implemented by well-trained staff, which you'll all be after one session. Just kidding, you have to get continual training. So we want to use a roadmap. And so the roadmap is, it shows your process. So it's not the outcomes measurements, it's how you do your work. How are you going to implement it? So what are the steps that you're going to take on connecting, your objectives to your activities, all of those things. So why do it? Why is it important to have an implementation plan that lays out how everybody's on the same page, it creates structure, we create a system for doing the work that we do. Clear roles and responsibilities. What else? Sorry? Accountability. Yeah, accountability is important. Being accountable to our team, to our funder, to our community, to our co-workers. Anything else? So there's a key thing that I see is we have transition in our programs, right? We have transition in the way we do our programs. Maybe we make some adjustments. We have transition in our staff. We have transition in our leadership. Maybe our comprehensive prevention effort carries over to different funders. Perhaps RPE is our funder for primary prevention, but OES is our funder for something else, and a foundation is funding some other great piece of work that is connected to our correlated set of risk and protective factors that we're addressing in our prevention program. Take a breath. People should be able to pick up that roadmap, that implementation plan, and be able to get a clear view of what you're doing, right? So we talked about that new staff member, throw you a binder, and go to do 6 presentations tomorrow, right? But if you have an implementation plan that shows your strategy, has your, attachments with your scope of work and your logic model, somebody can really clearly pick up that and see what your program is doing and what the goals are and who's doing what, right? So, so it keeps you on track for moving through those goals, and hopefully has some points in it that you might refer back to take a moment to look back and reflect and see what's working, what's not. It should include time that you're going over all of your evaluation tools, making sure that you're looking at all that data and seeing if there are things that need to be adjusted. Maybe it includes check-ins or a mini community assessment to kind of see where the program stands, to kind of reevaluate, are we in the right place? Are we hitting the goals that we thought we hit? Do we need to adjust something? Do we have the right people in the right place? So if you make sure that you have this roadmap lined out from the beginning, it's easier to go back and make small adjustments than, to have to be recreating the wheel every time. Okay. Last time. All of them. The cheat answers. So are there any principles that you think are specific to having a roadmap? Well-trained staff. Yeah. 6, 7, 5, appropriately time. 1, 2. Are y'all just yelling numbers? Yeah. 5. Positive solutions. 5 minutes. 5 positive solutions. Okay. So now we've come to the end. We went over best practices. We went over the history. We went through the 10 principles. We thought about how to apply them. We talked about all these best practices, and hopefully you learned about how to apply the 10 principles, and you thought about one principle that you'd like to focus on. Everyone take like 30 seconds to yourself. Close your eyes, take a breath. You don't have to close your eyes. Close your eyes, take a breath. What do you think is one of these principles? We're saying only one because you could really dig into one of these, and it's really hard to make sure you're applying them all, depending on your program. So what is one of these principles that you really like to think about applying more to your program? What's one that if you think about potentially, applying for that RSA that comes out if you don't have RPE funding now, what's one that you'll really want to pay attention to in thinking about conceptualizing your program? Maybe it's the first step. So maybe it's one you want to improve, but maybe it's one that you want to really look at first because it's going to get you going. So I'm going to ask 5 people to share what their one identified principle is. Go ahead. Well trained staff. Great. Wally. Outcome evaluation. Okay. Plus. Great. Okay. You can work together.
I think let's actually go through. Who's picking number 1? Let's pick 10 questions. Who's picking number 1? Comprehensive is your priority. 2, very teaching thing. Okay, notice we've got 2 people. 3, 4. You get people to do it. Sufficient dosage. Okay. Theory driven. All right, we got some theory folk. Exciting. Positive relationships. Okay, some of you will be working on their collaborations. Great. What about appropriately timed? How about socially, culturally relevant? A lot of people really thinking about that. Look there. What about outcome evaluation? We've got many people there. Well-trained staff. Well, you are training junkies like well. And evidence-based. Okay. So I really want you to make that commitment and maybe find someone here find one person here that you can check in with. Sort of be your accountability partner. Be able to do this so you can take it along.
And if you didn't see anybody who raised their hand or don't know them to connect with, you can connect with us. Because we want to hear from you again. And we're here as a resource. Connecting people is one of my favorite things to do. But at Calpaso, we really want to be conduit for connecting people with one another with tools and resources. So please reach out to us after this, Megan, David, and I. Megan. Oh, Megan's the back. No. She went to Mason. All right. So thank you. We are going to send out a survey. I think it will be electronic, unless Megan walks in like 1 minute. With the paper survey. Do you have them? Okay. So we're going to ask you to fill out a paper survey, please. And David's going to pass them out quickly, and so that you can get on your way. And we appreciate you really taking time to give us feedback. And we hope you have a great day today. Great experience at the conference. So goodbye. Have a great day. And hopefully we'll